Montreal continues to confront a growing public health crisis, overdoses, and harm associated with unregulated substance use. Advocates argue that promoting safe, legalized, and regularized consumption is not just a matter of policy, it is a matter of life and death. Proposed regulations, including Quebec's Bill 103, which restricts supervised consumption sites near schools and daycares, have raised concerns among health experts and community organizers. They warn that such limitations could reduce access to life-saving services, increase stigma, and push vulnerable populations further into risk. Harm reduction programs from supervised consumption sites to outreach and prayer support have repeatedly shown to save lives, connect people to care, and build community trust. Yet political rhetoric continues to mischaracterize harm reduction as permissive or morally questionable, obscuring the evidence of its effectiveness. To explore these issues, we spoke with Bawe Lambert, a harm reduction worker deeply involved in Montreal's frontline response. Lambert discusses the prejudices facing harm reduction, the vital role of supervised consumption sites in protecting lives, and the importance of sharing success stories often overlooked in public and mediatic debates. Hi, Bawe.
Hi.
Thank you so much for joining us for this interview. I really appreciate you giving us your time. So, if you would be ready to get into it, I was wondering if you could please state your name and what you do.
Yeah, so I'm Bawe. I'm a arm reduction worker, community organizer in Jojage, Montreal. I focus primarily on people who use drugs, um, marginalized people, Afro-descendant, queer, and trans communities. I do also training, outreach, and policy advocacy.
Perfect. Thank you so much. So, I feel like a lot of people don't really understand what harm reduction is. Is there a way you could actually explain what it is in like simple terms?
Yeah, so when people ask me what arm reduction is, basically arm reduction is everywhere. Plainly, it keeps people alive and safer and connected. Instead of telling someone not to do something, it's basically finding ways for them to do it in a way that is safer. So, really simple example like seat belt or a really big arm reduction tool. Instead of telling people not to drive because they can get into accident, we create a seatbelt to prevent people from getting harm as much as possible during car accident. Same goes with parachute. Any tools that prevent harm instead of stopping someone from doing an action is arm reduction.
Perfect. Thank you. That's actually very interesting and really good comparison that make it quite easy to understand. I was wondering why is it so important? Why is harm reduction so important in the Montreal context?
In Montreal, we're facing a really rising overdose crisis, especially because of toxic supply. And so harm reduction is very important because kind of like in the same principle of the car driving, people have been using drugs for centuries. It's not new. It's not gonna necessarily stop or so instead of telling people not to use drugs, we want to find ways to help people using drugs in a way that is safer, in a way that people can have informed choices regarding their substance use, and mostly just in a way that saves people lives. Because right now there's over 3 people that die of an overdose almost every day in Montreal. So our goal is really just to reduce the death toll.
I feel like just like the way people seem to not understand what harm reduction is, a lot of people also, there's a lot of misconceptions about
Mhm.
harm reduction. What are the most common misconceptions about harm reduction that you've encountered in your work?
Yeah, I would say the number one is harm reduction enable drug use. And the reality is that it doesn't enable drug use. It reduces death and disease and increase the contact with services. for people who use drugs. So, I think one comparison that I often use is like with alcohol. During the alcohol prohibition, people didn't suddenly stop drinking. They would still drink, but it was alcohol that was really harmful for their health, that would make people blind, that would cause people to die. So the same thing can be applied to drug use. Harm reduction doesn't enable drug use or make people use more. People are going to use regardless. Our goal is really just to make sure people don't die, and people who are dead cannot, access services. They cannot try to reduce or manage their drug use. Another one is that the SCS make neighborhood less safe, and evidence shows that SCS centralize use indoors instead of having more people using in public, injecting and having needles in public spaces. So it doesn't make the space less safe. On the contrary, it keeps it contained into one location and inside of the location. And another one that also is pretty common is that you have two choice, which is treatment or arm reduction, when the truth is both are needed. Like the SCS often bridge people to services, to detox, to safe housing. So we need both in order for it to work.
Thank you. I know that in your work as well, you've mentioned that like discussions around harm reduction, sorry, often lack like intersectionality.
Mhm.
So from the work you have done and what you have seen, how does race, gender, the line of work, and sexuality shape the experiences of substance users in Montreal?
Well, basically, risk and access aren't equal. Racialized, trans, sex worker, street involved people, they face profiling, housing precarity, language barrier, stigma in healthcare, more than other folks that are not this marginalized. So intersectional arm reduction means services that are led by and tailored for the communities that are the most affected. It means, having opening hours, languages, transforming care, peer hiring. It means tailoring the services to the people who needs it the most. For me, that's what intersectionality and harm reduction comes to play. Um, and also, Afro descendant, queer, and trans communities face more specific challenges, like I was saying, like stigma and discrimination in health and public services, because of fear of being mistreated or outed, or over policing, certain neighborhoods, displacement from safer space, especially for people that are unhoused, language barrier, English and other languages face a lot of extra hurdles to navigate the Quebec health system, especially with like newer bills, and also economic precarity and housing barriers. It's just, and those amplify overdose risk and reduce the ability to travel to services.
Uh, some political figures like Pierre Poilievre recently called safe injection sites drug dens and a myth. What
Mhm.
impact does this kind of rhetoric have on harm reduction efforts in Montreal?
Well, it's very harmful. It stigmatizes people. It undermines the trust um, that the public might have in those services, and it confuses the public about the evidence that SES does save lives. And it also makes funding and exemption even harder for us to attain when it's already something that is so difficult. Um, and so in practice, what it means more deaths from a toxic supply, because we cannot, have our safer injection site. And they're not myth. I'm not sure what Pierre Polyev meant, like, by a myth, in the sense that those doesn't work or they don't really exist, but they're certainly not drugs then, and I don't think Pierre Polyev visited any safe injection site. If you visit one, which I highly encourage folks who are curious or questioning to visit one, it kind of looks like a hospital. It's very clean. There are worker there to make sure that everyone is safe. There's different station where people can use safely and in a clean environment. It's far from being like a so-called drug den. It's very organized, and it has its purpose and its need. And I think it's very harmful to be confusing the public by comparing safer injection site to drug den. I feel like, to me, it kind of is the same as saying that hospital have clandestine, like, um services, and like fake surgeries or anything like that. It's just not true. It's like, it's very safe, it's very clean, and yeah, it's just a place where people can access services that they need.
Thank you. So to go back to what he was also saying, or like what people have said, there's obviously a lot of fear mongering around
Hmm.
supervised conception sites. Like I feel like, as you said, a lot of people don't really realize that like those look like hospitals or
Hmm.
have the same kind of structure as hospitals. That's not what they picture when they think about that. So I was wondering, because there's been a lot of talk around that. Um, in terms of like their locations, people have been saying like they shouldn't be near playgrounds or near schools where there's youth. So how do you respond to those concerns about their locations?
Right. So it comes back a little bit to what I was saying, in the sense that, like, SCS are clinical spaces with trained staff, protocols, security, and, like I was saying, they reduce the public use. So instead of having folks using outside in plain sight in front of those so-called schools and whatnot, we have folks using inside the supervised consumption site, thus reducing the chance of them using nearby school. And also, we have, program to take care of discarded needles that are near the school, and also, like I was saying, by moving the use indoors, most of those discarded needles will stay indoors and not be scattered around the playground or the schools. So it's actually beneficial for everyone to have those nearby, because instead of having those needles laying around outside, well, they will be taken care of before they even reach the playground. Um, and also, it the exterior presents, like, and the hours, the community outline, the needle exchange program, those all co-create good neighborhood and good environments for everyone. And though the distance sounds like a distance rule, being X amount of kilometer away from a school seems simple for some folks as a solutions. Um, but in reality, it just pushes services away from where the harm occurs, which just worsen the street use and worsen their response time, when it comes to helping people who use drugs. One of the main principle of harm reduction is meeting people where they're at, and it's important that we have services that are near where people are using, and not far away where people won't be able to reach said services.
So based on what you just said, I'm guessing that like the choices for locations, how they're selected is, as you said, like the fact that where they find that there's more people using substances, and then that's where they're gonna place and open safe injection sites.
Hmm. Yeah, so basically, it's an evidence based way of choosing the location. Usually, we want to be near where there are overdose, like so called hotspot, where the data shows that there's most people who use drugs. It often involve a community consultation, a public safety plans, clinical protocol, also thinking about staffing hours, capacity, overdose response, monitoring. It's very complex. It's not just something that is chosen willy-nilly, and like, we take into consideration a lot of different factor before choosing the location of a safer injection site.
Thank you. So, based on like again, this is of like that those are drug dens, that safe injection sites are drug dens, that they're a myth, or that they shouldn't be close to schools or playground, and just like the image that people have in mind of safe injection sites that are very like obviously outdated. How do you address community fears and opposition to harm reduction services?
Um, I think we need to lead with data and like local listening. Like, if we share more outcomes, for instance, like I was saying, the amount of overdose are being reversed, the amount of needles that are fewer now that we have safer injection site, the amount of public use that is being reduced, and if people were aware, I feel, of those data, they would probably have less fear and less opposition. Also, we have to think about like creating like a good neighborhood, good neighborhood, um way of thinking. For instance, like, we have, like I was saying, needle sweep schedule, we have outreach patrols, we have phone lines for concerns, we have, incident transparency dashboards, and I feel like people are not taking advantage of those things. And it's so easy to just phone a SCS and have a civil like conversation about your concern. And if you have questions, instead of like listening to fear mongering, like, get come talk to us, get informed about what are the services we're doing, what are we doing to reduce the concern you might have, like the needle laying around the street or the amount of people using. And finally, I think we need to humanize the issue, because I think the main issue is that people using alone in the streets, like, it might be disturbing to some and it might not be something you want to see or think about, but those are our neighbors. And they are people just like you and me, and they deserve care and dignity and love and support like anybody else. And though it might be a reality that is hard for some to grasp, acting as if it doesn't exist or wanting to look the other way is not going to make the problem disappear. What is will make the problem disappear, though, is getting involved with arm reduction services, is fighting for better policies, is to reducing the amount of toxicity in the drug supply. It's keeping them alive for them to reach help so they can get better. Those are things that are tangible that will make a difference, but fear and opposition is not going to help the situation.
Thank you. Thank you so much. So while you were answering the last question, you mentioned the numbers of showing how harm reduction has actually helped people. So can you share like success stories or positive impacts of safe injection sites that you have seen in Montreal that do not get enough media coverage?
Yeah, I feel like the first one I was thinking about is like the the amount of on-site overdose deaths across Canadian SCS dataset. Most almost 99% of the time, the team managed to reverse overdose, and not just manage, like we reverse overdose on the daily. We save people alive on the daily, and I think that this is not talked about enough. Like the amount of life that could have been lost to the toxicity of the drug and because of the opioid drug crisis. And we are literally saving lives every single day. And I find that like we often talk about like, oh, surgeons are saving lives and doctors are saving lives, but you won't hear about like harm reduction educator or support worker and how they are, on the daily saving lives of people by reversing overdose and preventing overdose to even happen in the first place. Um, so yeah, providing supervised injection, inhalation, providing access to nursing, referrals. We are quietly preventing a crisis and reducing public uh, consumption downtown. And I feel like people are not really talking about it. When we talk about it, it's to complain about the amount of people that are using, but we never talk about the amount of people that are not using because of those services. And I feel like we are not also reporting the hundred of overdose that are being reversed every year. Highlighting how people don't die inside over supervised consumption side. um, you know so I think, and I think it's just a thing with the media in general. We have tendency on focusing on the negative, and instead of showcasing the positive. So I really appreciate having the opportunity to talk about how beneficial those services are, and I hope that people will come to understand that you know those services and harm reduction is beneficial for the community as a whole and not just to people who use drugs. It's beneficial for their loved ones, it's beneficial for society, it's beneficial for both people who use drugs and people who don't use drugs. Um, and at the end of the day, again, like I was saying, they are your neighbor, and I like to think that you don't want your neighbor to die, and that's what we're doing. We're preventing death.
I did have a question regarding something you just said about the toxicity of like certain drugs, for example. I feel like for a lot of people, when they think about substance use, they just imagine that drugs equals anything that's not weed or like alcohol equals like leading to an overdose for sure. Could you talk about like actually like as you said like the toxicity? I know that when there was the event last week for the Overdose Awareness Month. Some people said that it's not actually the drugs that actually lead to someone's death. It's like they might be laced with something, or maybe sometimes like it's really like an amount, but it's not the drug itself. And yeah, I was wondering if you could
Yeah,
talk about this a little bit.
of course. What I would say is that drug use and drugs are not inherently bad in themselves. We are right now living through a toxicity crisis when it comes to our drug supply. And a little bit like I was talking about with alcohol. During the prohibition, alcohol was created in clandestine ways because it was the only way to produce something that was illegal. And so that led to people using substances to produce alcohol that were very damaging, that could cause death, that could cause blindness, that could cause an array of illnesses. And so we're basically just experiencing the same thing with the drug supply. It being illegal means that there's no one to supervise the manufacturing of the drugs. There's no one to say, oh, you can or cannot use X products to cut your drugs. And also it leads to a plethora of issues, like with violence between the sourcing of the drugs, gang violence and whatnot. And so people cannot necessarily buy the materials or the components that they need to produce drugs, because it has been made illegal, as to reduce the chances of people creating drugs, which is silly because people are going to make drugs anyway. The only difference is, instead of using things that are less harmful, they are now kind of forced to use products that are more toxic or more dangerous to produce the drugs. And that has led to having a toxic drug supply. And that's why a lot of us in harm reduction field are advocating to decriminalize drugs, so that we can have drugs that is not laced with so many things that can cause harm. In BC, there were great initiative with people that would, such as Dolph, for instance, that would provide folks with drugs that were tested, and that they made sure that was free of other agent that could cause harm. And out of all those safe supply that was distributed, zero overdose that occurred. So it has been proven times and times again that prohibition is directly, responsible for the death of people who use drugs. Overdose death are very much preventable, and every overdose death is a policy failure. And there is ways to stop people from dying. It's just not being um it's just not being done at this point in time, unfortunately.
Thank you. So you just mentioned policies, how it's a policy failure. So I was wondering, how do government policies, like that it is federal, provincial, or even municipal, how do they create barriers to harm reduction work?
I mean, there's a lot of barriers, exemption, and shifting political signals create uncertainty for us, because we never know when we'll receive fundings to offer life-saving services. uh, the enforcement of the police presence also deter access to services, pushes people to use alone. And one of the main thing that we keep saying to people is, do not use alone, because then there's no one to help you or reverse the overdose, or even save you if something happens. And so law enforcement is definitely something that very much affect people who use drug. Even something as simple as ticketing someone who is on a house is very pervasive, and contributes to the issue at hand. The distance buffer and centralized relocation and service shrinkage is also contributing to the deaths of people, which is very concerning, because the overdose crisis just keeps getting worse. Yet the money allocated to the services and to the solution to the crisis are being reduced a little bit more every year, when it should be the other way around. So I think a lot of us are very concerned, regarding how we're going to be able to keep people alive with the small amount of funding and resources that were allocated to do so.
Thank you. And one thing you mentioned was policing. And so many people like oppose safe injection sites, and they think that instead of having like safe injection sites, we just need more police around to supervise drug use, right? Substance
Mm.
use. So, in your experience, would more policing be effective or beneficial for harm reduction efforts?
No, definitely not. Actually, evidence shows that criminalization and displacement increases risk of overdose deaths. Using alone, like I was mentioning, sharing equipment, rushed use. We need health, a better health system, and we need housing, not criminalization. And further, marginalizing someone who's already marginalized will never help, you know? So I really do not believe that policing is making the solution better or is helping the solution. If anything, it's causing more harm, especially when you think about the fact that a lot of people are already very distrustful of the system, and being arrested and having to deal with police when you're already marginalized and struggling is very stressful and very traumatizing, which only increases the chances and the risk and chance of using drugs to cope with the situation, to cope with the trauma, to cope with just this, the fact that you're unhoused, or that you're living through a lot of marginalized issues. And so police is not helping. The move along order and visibility sweeps only displace people from outreach, from transit space, from places where they can reach help. And ticketing and unhoused judicialization is in my opinion, a waste of time and money, and only pushes people further away from care.
Thank you so much. That's really insightful. There was something you mentioned at the beginning of the interview where you mentioned the language barrier for non-French speaking residents.
Mhm.
So I was wondering, what challenges do non-French speaking residents face when trying to access harm reduction services in Montreal, for example?
Well, it created issues where English and other speaking people can't really access health or social services. Um, and people face inconsistent language access, the forms, the navigation, which all delays the access to care. Um, so that's a big issue. Obviously, us community org try to fill the gap with peer interpretation, but that's not sustainable in the long run.
Thank you. You also mentioned funding, and this is something that was also mentioned at the event last week for Overdose Awareness Month. So, harm reduction services already struggle with precarious funding. How do political attitudes and public misconceptions affect financial support and resource availability?
While public misconception and politicized rhetoric makes funding precarious, it really does. And as demand rises, even with new envelope, community org remain really stretched in when it comes to receiving funding. And we need this creates interruption of services. We have a shortage of staff. People are burnout, form the crisis level, and the demand that we receive. Operational costs, security, relocation, extended hours, outpacing grants, and also the supplies. we it's all something that is very hard to maintain, like the naloxone distribution, for instance. um yeah, we need funding, we need money, and it's very frustrating to see that there is so much, we have this fake idea of scarcity when there's actually so much money that could be invested in public health. It's just that we decide not to do so, and the public misconception very much affect that, because if the public were on the side of arm reduction and were aware of how much arm reduction benefits everybody, I think that we would be seeing more people advocating for fundings being allocated towards those services. But because those services are seen as either not helping or obsolete or reinforcing even the issue, well then nobody cares about us not being funded adequately, when in fact it doesn't only affect people who use drugs, but it affects our communities and society as a whole, because people who use drugs are not going to go anywhere, and not providing services to this population is not going to make this population disappear. Is just going to cause more deaths and more harm and more burden on the healthcare system, when it is what we're trying to prevent. And so I really hope that the public misconception of harm reduction, and that political politician will finally realize that investing money in harm reduction is saving money for the healthcare system as a whole in the long run. It's an investment. It's an investment in health, in people, and mostly it's an investment in saving people's lives. And you would think that saying to people that it would prevent death should be enough to convince them to make changes, but apparently, well, not just apparently, I think it's become quite obvious that some lives matter more than others, and some lives are considered less important or more disposable than others. And so I will add again, drug user, unhoused people, marginalized people, they are your neighbor, they are your kin, and they deserve support, and they deserve to live.
Thank you so much. I was wondering that I like the interview was pretty well rounded. So, but I was wondering, is there anything I did not ask that you would like to discuss or add that you felt is missing from this conversation that people should know about?
Mm, I think I would add that we should protect and expand supervised consumption side, you know, and instead of seeing them as not useful, we should, support, protect, and expand those services. Um, and also scale low barrier care such as drug checking, safer supply pilots, housing for marginalized folks, and also keep peer leadership always. We often say as drug user, nothing about us without us, and I think that lived experience is so rich when it comes to knowledge. It's very important to create services with the people that are will receive said services in mind. They should be directly involved in the creating of those policies and in those services. And not only should they be involved, they should be properly compensated for their knowledge and for their time. um, and then finally, I would say guarantee language access for everyone, anti-racist, trans-affirming services, um, for the community at large. Yeah.
Thank you so much for this interview. It was really insightful. I once again really appreciate you taking the time to talk with us and talk about a subject that, as you said, is not often covered in media. So yeah, thank you so much for taking the time to speak with us today.
Well, thank you for having me. I really appreciate having the opportunity to share those information. I hope that it will, make folks want to get involved in the good fight.
Thank you.